What's going on YouTube? It's your boy Mikes and Vlogs, man. Today we're going to be talking about how I was able to not only do well in pharm my first semester of nursing school, but also how you can do it too. Beautiful day outside, and I cannot help but to come out here and make the video. I'm going to go over the common mistakes that I see that I personally made as well, and then we're going to go over my personal study tips after I've already completed pharmacology. My first semester of nursing school is actually done. Yes, sir. First semester of nursing school with A's, and you guys can definitely do it too. We're gonna go over my mistakes, the mistakes that I see, personal study tips. In my backpack, I brought resources that I use that I'm gonna share with you all. Let me get to where I'm going, and I'll set up shop, and then we'll go ahead and get into the video. It's your boy Mikes, and like I said, I actually just finished up my first semester of nursing school in an accelerated program. It's a lot, and as you know, pharmacology is one of the first classes that we have to take, and I made an A in pharmacology. Maybe in the next video or something like that, matter of fact, I'm gonna show the grade in this video. There's no capping going on here, man, so I'm gonna show that. Give me a sec, I'm gonna go ahead and show that right now. So there you have it. That's my A. I'm gonna help you guys get there too, man. The most common mistakes with pharmacology, because we're dealing with so much information, right? And you guys know that too, if you guys are taking it or if you're about to take it this next semester coming up, it's a lot of information. Not just for an ABSN either, it's a lot of information coming at you really fast. So with that being said, since this is the common mistakes, don't over read. For one, you wouldn't be able to finish in time. For two, you're not going to be able to retain the information that you just read in regards to those certain drugs. So that's number one tip for common mistakes is over-reading. Do not, it's hard, especially starting out, it's hard not to just divulge and just get completely into it, but my advice would be not to spend way too much time going so in-depth on certain things. Another thing would be when we start getting into the drug names, and I've actually seen people in my cohort try to do this. They'll actually try and become a human note card. You do not want to become a human note card. Trying to remember every single calcium channel blocker that we went over. You're trying to remember every single hypertensive. Think about what that's going to do to you over time. You can't. I have nurse friends right now, and they probably couldn't tell you what we know right now. What you're going to know. It's because we are not human note cards. I mean, you can't do that. It's not impossible, but it's extremely hard for every section to sit there and try and remember every single medication, the adverse reactions, the contraindications, and all that for every single medication that they give you. And I'm giving you a heads up, they're gonna give you a lot of medications. A lot of medications. So a huge mistake would be to try and remember every single medication. Another huge mistake, and I want to give a big shout out to the tutor that we had, would be overthinking and changing your answers. NCLEX style questions, never seen anything like that before. I have a degree in finance. There's one answer. The answer is A, B, C, or D, right? So when you're taking these NCLEX style tests, or the NCLEX period, normally you can rule out two pretty quickly, but there's two that are right. You have to pick the one that is most right in regards to the circumstances, the patient presenting, etc. That's a mistake, overthinking. And another humongous mistake once you get further into pharmacology is changing your answer. I'm a victim, and I'm here to tell you guys so you don't make the same mistake I did. Let's go ahead and get into my personal study tips. How I made an A. That is my study tip for you guys, to focus on the generics. Do not learn. I wouldn't even learn them. Don't even look at them. Don't even look at the brand names of the drugs. Generic only. Get comfortable and start looking out for suffixes, ending of the drug. For example, metropolol, olol, propanolol, olol. All classes of beta blockers. A lot of these drugs will have the same, generic only, a lot of these drugs will have the same ending, and you can, not always, but I made an A, and this is what I did. I lumped them all together. So after you lump them together, what you're gonna wanna do, you're gonna wanna learn the drug family, what it does, for example, calcium channel blockers, beta blockers, etc. look at their suffixes, and then they go together. And then the next step in that would be learn the mechanism of action, learn the contraindications, learn the major adverse effects for those drugs. And I can't promise you, but I can like 99.99999% assure you that you will not only be okay in terms of memorization, but you'll be able to answer questions that you haven't seen if you're understanding the drug class category of beta blockers, and you know that they end in O-law. So you see a drug that you've never seen before and it's O-law, oh, beta blocker. Okay, with the beta blocker, what does that do? Okay, I know what this does. I know what I'm gonna see from this in terms of slowing everything down, right? So then you learn the contraindications and what can a beta blocker do with hypoglycemia. So it's just like, and that's just for that family beta blockers. 9 times out of 10, the adverse reactions, contraindications, what they're used for are going to be the same thing. That is going to save you so much time. Get the class, the family of medication down. You get the names, the suffix, the ending. So even if it's a drug you've never heard of, but it has a suffix, you're good to go, right? Because you understand what this class of drugs do, how they work, the mechanism of action, the contraindications, the therapeutic, goal, what this medication is for, and you'll be able to answer a whole lot of questions without even looking at XYZ medication, just the bigger picture. So you got this. So don't spend your time worrying about these. Spend your time worried about, the bigger picture beta blockers. Okay, they end in O-law, so then boom, boom, boom. I'm telling you, do it. I'm telling you, you'll be all right. If you just do that, you'll be all right. I actually brought my book. And when I talked about don't spend too much time reading every single in the chapter, you will get behind. About 40-something pages. We got 40-something pages. They can't quiz you or test you 40-something pages because it's going to be wrapped up into something else. So then this is what you would want to do. You'd want to not skim, but you would kind of read for comprehension, but don't sit there and write notes for everything and do all that as you're going through the book. You won't make it to the end. So you want to go to key points. After you've skimmed and read for comprehension, then you want to go to key points. And this wraps up about 45-ish pages right here. And that's the most important information from the entire chapter. What I did, now excuse me, because a lot of people in the nursing space, they have these eloquent, intricate notes, and that's not me. I don't have bad handwriting, but I cannot sit there and do highlighter colors for just 1, for 2. If that works for you, I'm sure it's a lot easier, but I can't do it. Let me show y'all my notes. This is how I took the notes. Got Module 7, Chapter 67, Immunostimulants and Immunodepressants. These are what my notes look like. Underlining. There's not a highlighter in sight. Can't find a highlighter anywhere in here. No highlights, no pretty color coding, and that's no knock to anybody doing that. But just for me, I don't think that's necessary. I don't think it's necessary to do that. I made an A. If that's not your forte, you don't have to do that with your note. Another huge important tip is finding, if you're not really sociable, you're gonna have to work on it, man, because you're gonna be the nurse, you're bedside manner, so you're gonna have to talk to people. So this is probably like number 1, to be honest. This is probably number 1. Get together, and whether you're gonna Zoom it, that's what we did. We zoomed Rona on around and all that. So we just we Zoomed it, and we would delegate certain pages, find people, and we would meet 2 to 3 times a week. So find people for about an hour and a half to 2.5 hours every time. And that was so helpful because it was so many things that I learned that maybe I had not paid much attention to, or I added to them, and it's just, you can give and take. My advice would be, don't try and do it on your own. I wouldn't, because it's so much easier, and then you form bonds and you can get help and you can ask for help. You can learn things, get different perspectives, because you have your own study habits that you're gonna form. They have theirs, and you combine. There's people who are really not as focused as you would think that someone in that program is going to be. So find people that are just as focused as you, putting in an effort, and see if you guys can link up and do that. I worked really hard. I spent a lot of time, but I would contribute at least 35-40% of my success in pharmacology to group studies. It was only 3 of us, so It doesn't have to be a huge group renting out a library space or anything like that, but get with people that are, you know, that you guys can get together and make something happen for sure. So my last study tip would be taking advice from, whether it be me, whether it be another nursing channel, whether it be a friend who's already a nurse. Implement those, but also make it your own, right? So I did the same thing. I would watch videos after videos, and then I would come up with my own formula that fit me the best. You know, it's there's no one right way to do nursing. Finding what works for you, finding what times that you like to study, finding the environment that you like to study in. Don't think that you have to sit there for 6 hours at a time and do that, because for me, I couldn't do it. Other study tip: break up your studying. For me, going 3.5, 4 hours over text and doing all this, I'm checked out. I've done 8-hour days before, but I've actually done an hour, took a break for 2 hours, came back, did it for, you know, studied for 2 hours, took a break for 30 minutes, came back, studied for an hour. Whatever works for you. Over the resources before we wrap it up, it is Mosby's Mnemonic and Memory Aids for Nurses. Super duper clutch, a couple of times. I didn't use it all the time, but super clutch. You've got your contents, it'll tell you got analgesics, NSAIDs, cardiac, CNS, so it's all color-coded here. Antihypertensive drugs, right? So you see how it shows like this, antihypertensive drugs. You got your antihypertensive drugs classification, actions. ACE inhibitors block the conversion of angiotensin. Beta blockers block the B1 receptors in the heart. CCBs, calcium channel blockers, block the calcium influx into the beta receptors, which is gonna, you know, decrease the contractile force. So it's just like, this is clutch. Like, this is really clutch. Got highlighted patient teaching, which are in-style, NCLEX type questions. Which question indicates that the patient needs further teaching? And it's all right here. Not the question, but stuff you want to, you know, relay to the patient. That's really good stuff. And then it's got the actions of the ACE inhibitor. So you got, it says it right here, but then you got pictures, you know, side effects of ACE inhibitors. So ACE inhibitors are going to have essentially the same side effects. I mean, that goes back to what I said earlier. So these are really, really clutch. The Davis Drug Guide, I rented this from Amazon, by the way, the Davis Drug Guide for Nurses. It goes over the things that I talked about earlier that you need. You've got your patient teaching, your indications, and, you know, adverse reactions. And this is highlighted in red. Advise patients to notify healthcare professional if rash, muscle weakness, cramps, fatigue, or severe nausea, vomiting, diarrhea occur. Those are the type of questions you'll see. So now you understand with your thiazide diuretics, which is the class, and then you go into the chlorothiazide, hydrochlorothiazide. So now you've got the adverse reactions, what to teach the patient, evaluation, what it's used for, potential diagnosis or indication for why you would need a thiazide diuretic, the side effects, the adverse reactions. All of that is under here, under diuretics, under thiazide, because there's different types of diuretics. It makes it a lot easier. It's still difficult, but it makes it a whole lot easier. It's all I use to make an A. I want to leave you all with, you guys are about to be here, or you guys are already here. That's a lot of work already put in. So my advice, some more advice, help, tips would be, don't give up, because you can do it. If you can do your HESI, if you can make the good enough grades to even get considered for admission into a nursing program, I promise you can do it. Don't beat yourself up. Don't beat yourself up if you don't do too well on your first pharmacology test, right? Because you don't know how the questions are gonna come. Hopefully you can look at the answers, evaluate, okay, so I need to study like this because the questions look like this. All I got, man. So I wish everybody watching this the best of luck. If you guys have any questions, drop them in the comment section below. Everybody for sticking around watching. And like I said, y'all can do it, I promise you. Because if you're looking at videos to try and get ahead of the curve and do that, that's already +1. I hope everybody makes it through, and I hope all you guys make A's, to be honest, because it's a really good feeling. Even if not, if you make a B, a nurse, hey, certified nurse. Like I said, don't beat yourself up too much. These are just my tips, essentially led me to an A. But like I said, it's your boy Mikeson. Appreciate everybody for tuning in, man. Stay with me on my nursing journey. Let you guys know once I start clinicals. Ooh.